Okay, welcome. Hi, this is Designing a Gratifying Postpartum Massage Session. This is going to be about a 2-hour talk, all about how to really personalize a postpartum massage, how to move out of just theoretical knowledge of postpartum massage, and how to really take universal postpartum needs, your client's individual needs, and tie them together into a very individualized and thoughtful session. I am Sparrow Harrington, and I am thrilled to be walking you through this today. I am the owner of a wellness center for moms called Sparrow's Nest, and I am an authorized instructor of Carole Osborne's body of work. I teach her hands-on 32-hour pre- and perinatal massage therapy workshop, and I'm a NCBTMB provider as well. And let's see what else. I love working with new families. I have been a massage therapist since 2007 and specializing with new moms, pregnancy and postpartum since 2011. I've been to many births. I was a midwifery student for some time, and it just never gets old. There is, in my mind, no more deserving of a population to work with. It's incredibly gratifying. And sadly, there's a huge gap in how much their care and their needs are being fulfilled. And so I hope that this workshop today is going to really illuminate that and show how important you as a skilled massage therapist can be in really meeting the needs of this highly deserving population. All right. So as we move through today, this is everything that we're going to cover on this slide. We're looking at like the overview of the cultural climate that postpartum moms are dealing with. These are things that are outside of their control, but I think as therapists, it's important to understand kind of what are the bigger structures that are in place that are trickling down and affecting this person that you are working with. So we're going to be looking at the cultural climate. We're going to be looking at some of the biological realities of postpartum, looking at where there are some ideological gaps. A lot of people don't understand how long it takes to recover in postpartum, and they have this expectation that their bodies are supposed to bounce back in 6 weeks. And that almost always is not the case. And so when we as therapists have an understanding of what the biological design is, we can help guide our clients towards more gracious and more realistic expectations of themselves. We are going to talk today about universal and individual needs in postpartum. We are going to talk about safety and comfort considerations as well. What's the best way to set up? What kind of supports do you need? And then we're going to get into some of the nitty gritty details of it. How do we pull all of this information together into a unique session that is going to be specific to your individual client? We're going to talk about their requests, how to best support them comfortably, which positions would be ideal for which people, how to order your techniques, and then we'll go through some case studies together so we can see what it would look like for real people. All right, here we go. So today we're going to be really talking about how to take some of the theory and put it into practice. I'm not going to actually be teaching massage techniques today, but I will be referring to several, and I'll show you in the next slide where those techniques are coming from. If you have a desire to look some of them up, they're wonderful. And then I also just wanted to give the disclaimer that this webinar is not going to go in depth into safety knowledge. I will review it, but it's almost coming in with the assumption that you have a background in the in-depth safety knowledge. And so if you do not and you're watching this, this is an invitation to dive deeper into that before you're working with your postpartum clients. And this is a wonderful resource to do that. So this is the Pre and Perinatal Massage Therapy textbook. It's written by my mentor, Carole Osborne, and Michelle and David are also co-authors. They are some of my colleagues who are also authorized instructors of Carole's work. And this is our kind of foundation of what we teach comes from this book. The 32-hour pre and perinatal massage in-person class has all of the techniques in this book, plus some that we only teach in person. These are really anatomically specific techniques that we only teach in person because we just want to make sure that everybody gets them right. And this is, again, just a super wonderful resource. If you want to review safety techniques, this is the where to go. This is where to get it from. So I just wanted to show you the textbook here. All right. Oh, this beautiful photo. Brand new baby. Mama has just done so much work here. And so we're thinking about what a huge transition birth is mentally, physically, emotionally. And that is true whether your client is a first-time mom or an eighth-time mom. Every single time you go through the birthing process, it is transformative by its very nature. And you were constantly rebirthed as a mother to whatever child this is and whatever subsequent pregnancy this is. And to fully recover from this, it really takes rest. It really takes rest. And that rest doesn't just impact your immediate health, but it really impacts your long-term health. And we're going to talk more about that in a couple more slides. There's also a tremendous hormonal shift to facilitate lactation that our clients are going through at this time. Uterine involution is happening, which just means that the uterus, was enlarged with the baby, and it's going to start involuting, getting smaller and smaller, getting back to its pre-pregnancy size. And that often will cause after pains. Mothers who are in their second, third, subsequent pregnancies are generally going to have more after pains than first-time mothers. So that's also normal to keep in mind. Everyone is going to have a weak and uncoordinated core immediately after giving birth. That rectus abdominis has stretched, and the relaxin in the mother's system has really worked to soften her core, and as it should. There is reason behind that, but in the aftermath of that, a lot of rest and slow recuperation to get that brain and core connection back online is really important. Pretty much everybody is sleep deprived, like clinically sleep deprived, in new motherhood and in new parenthood in general. That sometimes it's not just the mothers. And then there can be a full spectrum of emotions. And we as massage therapists can really hold a lot of space for that. And this is not about fixing anything. This is not about having answers, but really just having active, compassionate listening and holding space for those emotions. And that can be, real grief if someone, had anything from, a disappointing birth experience to something as serious as losing their baby. And then on the other side, there can be somebody who was elated that had a beautiful birth and everything's, on the surface, everything is fine. But sometimes you can have grief just from your baby being outside of your body and no longer being with you. So there's just a huge range of what can come up. And we need to be prepared to hold space for all of it. In the United States, we are doing an overall terrible job of caring for new mothers. The postpartum care is pretty much limited to 1 to 2 visits. We lack many traditional structures and understandings and practices to help new mothers and babies thrive in this time. And then we also have very inadequate maternity leave. And so many women are being forced back into the workforce too soon. And there are consequences to this. And this is not just about getting forced back into the workforce, but our postpartum maternal mortality rates are extremely high in the United States, and they are 4 times higher for Black women. And that can really only be reasoned that it comes down to institutionalized racism and not believing a Black mother when she is expressing pain, when she is expressing a concern. And so that is something else that we have to take very seriously. And as massage therapists, being very aware of how we are showing up for these clients and what they might have been through in their birthing process. So these three photos are what postpartum can look like and what I wish it looked like for everyone. There is an understanding in many traditional cultures about the golden month or the first 40 days, which really emphasizes rest, recuperation, nutrient dense foods, and family bonding. And this photo of the woman in the bottom left, her name is Mayra Jimégalguez, and she is a traditional midwife. She was my midwife for my second birth. And this is what she does. You can see in the bottom left corner that she's wearing the new baby, and she is doing body work and some closing of the body, closing the sheets around the mother's feet, to help draw energy back to her midline, to help close after the great opening that is birth. You can see in the middle photo, she has a belt, and inside that belt, each little circle has moxibustion burning to keep the womb warm. The mom is wearing some, postpartum disposable underwear. She's still bleeding, and then in her lap is some homemade khichdi, which Maida made, and that is just an easily digestible, nutrient dense meal. And then on the far right, this is actually me in my second postpartum. Maida came to my home and we did a closing of the bone ceremony on my 40 days of rest and postpartum. And this is something when we get to the end of the webinar, we can talk about doing a little bit of a nod to this practice. It's not a full closing of the bones, but it is something that we can do as massage therapists to, again, draw the energy back to that midline, do a little bit of a closing, and it is so soothing to the nervous system, and it is a nod to this practice in this photo. So there are many, many cultures listed, on this slide, and many that are not, that understand and embrace the importance of body work during this time. And as massage therapists, we can really bring this back into our clients' homes, or if they come and see us in our office as well. Another beautiful photo, a more professional photo of the Maida doing a closing ceremony for another new mom. And I just wanted to touch on the universal 5 postpartum needs. This comes from Kimberly Ann Johnson's The Fourth Trimester book. Every new mother is going to need extended rest. She's going to need nourishing foods. She's going to need loving touch, the presence of wise women, and communion with nature. And as massage therapists, we can certainly provide number 3 first and foremost. And we may be able to provide number 4, potentially. And if we can encourage the other ones. Maybe perhaps you could also bring food into your clients if that's part of your practice. It's certainly, nourishing foods is always wonderful. But I just wanted to illustrate that touch is a core component of what new mothers need to thrive in this postpartum period. And we're thinking about, if we can meet these 5 postpartum needs, it doesn't just impact their immediate postpartum. We talk about 40 days for 40 years. This can impact the long-term mental, emotional, and of course, physical health of the new mom, leading all the way into menopause. And when I was doing an interview some years ago with Princess McKinney from Bellybind, and she was talking about how there are studies that show that many elderly women who end up in nursing homes, they end up in nursing homes primarily because of issues with incontinence. And their issues with incontinence can primarily be traced back to their experiences with birth, and oftentimes of not healing properly after giving birth. And so you can see that there's a direct correlation between your quality of life, not just immediately in being able to, produce breast milk and heal after birth and bond with your new baby, but also how is that affecting your your crone era? How is that affecting you all the way down the line? So I would really love to emphasize the importance of really taking care of and taking seriously the rest and the recuperation. That is certainly not to say that anyone is doomed to that fate by any means, but I do want to emphasize how important it can be. And I often will talk to my clients about even retroactively giving themselves 40 days if they didn't know about it, or their life was not set up at the time to rest for those 40 days. Your body will, it's never too late, and your body will never be angry at you for giving it rest. So for example, if you have a client perhaps whose baby was in the NICU and she doesn't have time to rest, she's running back and forth to the hospital during her 40 days. Perhaps once baby's home and things have settled, that might be a time to return to this practice and to see if you can see if she can get herself the 40 days now that her baby is stable and she can focus on herself a little bit more. And then just thinking about how long does postpartum truly last? Is it this first 40 days, which is about 6 weeks? Some people will say, well, it took 9 months to grow a baby. It takes 9 months after to recuperate. Some people will say that hormonally and structurally, things do not look and function the same way for 2 whole years after giving birth. And then others say, and which is also really true, is that once you're postpartum, you are always postpartum. So I think the truth lies somewhere in that entire spectrum. And just holding that as massage therapists and perhaps reminding clients when they are feeling impatient with their bodies, feeling impatient with their process, that the reality is that oftentimes postpartum is much longer than we might otherwise be taught. Okay, mothering the mother. One of the things that we can offer as massage therapists is emotional support, active listening, and reflective feedback, really trying to keep the spotlight on her and not the baby. Oftentimes, and it's so understandable, babies are so precious, they're so cute, but when we are putting the spotlight on the baby and not on the mom, we're actually not fully serving the baby either, because the mother and the baby are a unit. We call it the mother-baby dyad. And so the baby cannot thrive if the mother is not doing well herself. So if we really want to show up for that baby and in fact for the entire family unit, we need to focus on the mom. We need to keep the spotlight on the mother. And by doing so, if she is doing well, by default, the baby will do well, because the mom at this point is the baby's entire world. The baby doesn't even understand that they are a separate being from mom at this point. So really keeping that spotlight on mom is serving everyone. We have the unique, I would say, blessing. Sometimes you might feel like it's a responsibility. Sometimes it may even feel like a burden to hear our clients' birth stories. We spend more time with our clients than many practitioners do, and we're doing it in a way that we're helping their nervous system feel so safe that we might be the first person that they tell their birth story to, the only person that they tell their birth story to, and we might be the first people that they are able to tell their story to, where someone else is not interjecting their take on what happened to them. And I think that we serve a huge service by allowing that to unfold. So she's going to need to make sense of her birth. She's going to reconstruct what happened and how she felt in her own words. And this is huge. So without somebody interjecting of like, oh, this needed to happen. Oh, you did this. This is what happened. Allowing her to make sense of it, and also allowing for the story to unfold and to change over time. We can really hold space for that. So, and the sooner that a mother can do this, the better influence it's going to have on her long-term self-esteem and mental health. And lots of times as massage therapists, when my client starts to segue into talking about their birth, I will often instinctually go and ground at their feet to help them feel safe and grounded as they are talking through their experience. Okay, so we talked a lot about rest, but yeah, these are universal physical needs. You can utilize slow, nurturing strokes to help promote rest in your postpartum clients. You can think about things like scalp massage, foot massage, and techniques to soothe the nervous system and to promote rest and relaxation. I will give a few examples of those from the pre and perinatal massage textbook that I mentioned in some later slides. And then obviously, structural rebalancing is also going to be huge in the postpartum recovery. We want to focus on rebalancing key muscles, including iliopsoas, gluteus medius, quadratus lumborum, releasing trigger points in the rectus abdominis and in the intercostals as well. Other considerations can definitely be tailbone pain if your client had a vaginal birth, if they were birthing on their backs, if they were birthing with epidural. Lots of time, the tailbone is a joint. And if a client is laying on her back while she's giving birth, that joint doesn't have space to flex because it's getting pushed into the table. Anyhow, tailbone pain is really common in postpartum. And so being able to address that, being able to work the attachments on either side of the sacrum can be just a game changer for a new mom and really help with her postpartum pain. In terms of body mechanics, we can also just take a look at things like if you're doing house calls, when you're coming into her home, look at how she's handling her baby. Most moms are going to be trying to top the baby off with a feeding, whether they're nursing or bottle feeding, and just look at how is she handling the baby? How is she, is she sitting in a chair and her toes are up on, pointed on the floor? She's holding herself up. Does she have support under her arms as she's holding the baby? These are things that we can take note of and offer some suggestions, because you can give the best postpartum massage in the world and leave her feeling amazing. And then she can turn around and, try and hold her body upright, with no support for the next day. And a lot of your work was just going to go to waste. So trying to help her find ways to find ease and use her body in ways that are conducive to her overall well-being and long-term feeling good in her body is also something that we can do to be of service to new moms. A well-designed postpartum massage is going to help foster a healthy start for the entire family. It's going to help, with the mom's recovery, and by default will help facilitate the bonding with the new baby. So we're going to focus on the recovery from birth and the physical strains of childcare. Remember, these moms are doing repetitive use. Like, a lot of them have essentially repetitive use injuries, whether that's in their wrist, in their thumb, in their shoulders from rounding. All of the anterior neck muscles are often shortened from craning over and holding and rocking their baby. So we want to be thinking about that as massage therapists. How can we start to undo some of those repetitive strains from childcare? We want to ease muscle tension, we want to improve circulation, and we want to help promote relaxation as well. When can this start happening? Well, potentially immediately after birth. And that can vary, highly on how soon after giving birth can a mom even kind of organize herself, organize you. But say she wanted it and she was feeling great and she had an uncomplicated birth, you can come immediately after birth. And then in any other situations where there was a C-section or there was any kind of complication with birth, you just want medical clearance. And I have worked, and you'll see the lymphatic massage can be really wonderful immediately after C-section for clearing some of that post-surgery swelling, which can be so painful. And I feel like perhaps it's just where I live in LA, but more and more doctors are not just giving clearance, but actually encouraging their clients to seek this out, which I think is wonderful. So potentially with a C-section, you could even be seeing a client right away. The one thing that we are wanting to be really mindful of is making sure that there's no signs of infection. That's really the biggest thing in postpartum is, there's no uterine infection, there's no retained placenta, things like that. So the medical clearance is really helpful for making sure that you are not doing any harm. This is a huge safety consideration in pregnancy, and it does not go away in postpartum. So the body is designed to have, higher clotting factors in preparation for birth, which is super smart and intelligent. However, as massage therapists, we just want to be mindful not to be dislodging blood clots. And most of these are going to be in the medial leg. So if you can see on the slide, the entire pink area on the medial thigh, all the way down to the medial malleolus. That doesn't mean that we can't touch this area. It just means that we cannot use anything but whole hand feather light pressure on the medial thigh. So for example, like if you're doing lymphatic work, it's okay to do that with that amount of pressure on the medial thigh. What we don't want to be doing is creating any kind of ischemic pressure in where we could release and a blood clot could potentially dislodge. We also don't want to be doing any jostling of the body, no shaking of the legs, no wringing of the legs, nothing like that. So nothing but feather light, full hand pressure on the medial thigh. And that precaution goes all the way up to 8 and possibly 10 weeks postpartum. I would say 10 weeks if there was any kind of complication, if there were twins, if there was a C-section, if there was any kind of like birth trauma, forceps, things like that, perhaps gear more towards that 10-week limit rather than the 8. The other thing that we want to be mindful of when we're doing postpartum massage, especially early on, is whether there are any injection sites. If somebody had an IV in their hand, if somebody had blood drawn multiple times, if somebody had an epidural, we don't want to be massaging over those spots without being mindful that that can cause pain. And then for C-section scar work, we're not going to be working actually on the scar itself for 8 to 10 weeks postpartum. And that is because C-section goes through several layers of tissue. And so what might look healed on the surface may not be fully healed in those deeper layers until 8 to 10 weeks postpartum. And C-section scar work is wonderful. I highly recommend it. We just want to do it in the most appropriate window. Great. All right, let's talk equipment. So this whole pillow package here is called the Oakwork Sideline Positioning System. I use it for my entire practice. For pregnancy, you can see this woman in the photo is pregnant. It works wonderful for pregnancy, but it also works wonderful in postpartum. So when we're thinking about our clients and what position would be good for them, do we want to put them in prone? Do we want to put them in supine, side lying, semi-reclining? There's a few things that we're taking into consideration. How postpartum is she? Is she nursing? What was her birth like? All of these things. So I still am highly partial to the side-lying system, and I'll get into that a little bit more in a little bit. But this is an option here, this entire system. These Pilo cushions, I'll show you how these work as well. These can be used in prone to support so that pressure is not put directly on sensitive breasts, but that can provide some cushion. And then you can never go wrong also with just using a good amount of pillows to support the body. So we can show you what that can look like as well. Okay, so side lying, again, this is my favorite for postpartum, and I will often use this for up to 6 months, even postpartum, especially with my clients who are exclusively breastfeeding. And here are the reasons: because it puts no pressure on tender breasts. And it is also a very easy position to include baby on the table if needed. Again, we were trying to keep the spotlight on mom, right? But mom is not going to be able to relax and enjoy her massage if baby is screaming for her. So sometimes it does look like we end up having baby on the table with us, and side lying is great for accommodating a baby in front of mom on the table. And it also fosters sharing, because we talked so much about how being able to debrief her birth experience can be so helpful. It's much harder to do that when you're face down on the table. This position fosters that much more easily. Okay. Here's prone. So these are those pillow pillows. I put the website down here too if you want to know more about them. They're great. They're designed to be placed under each shoulder, between the arm and the chest. They definitely reduce the amount of pressure on breast tissue when you are working in prone. However, and I've been doing this a long time, I would say in like 13 years, it hasn't been a lot, but I have had a couple of clients in that time who really wanted to work in prone. We put supports underneath their shoulders and they still ended up with a clogged duct after a massage. And for me, that just kills me, because our whole point of doing massage is to help them, right? So I didn't want to cause any problems. That's part of why I'm so partial to side lying positioning in postpartum, because again, there's no chance that you are going to adversely affect breast tissue. Now, that being said, you're going to have clients who understandably are like, I'll take my chances, or like, I'm not prone to clogged ducts. Breastfeeding is going well. I think, the supports under my breast will be enough, or I'm willing to risk it. Like, I just want to lay on my stomach, and that's never a problem. Most importantly, we just want to give our clients full informed consent of like, here's why I really like to use side lying, because it has no potential of putting pressure on your breasts. Here's what I can do to support your breasts, and then allow your clients to decide what works best for them. The other consideration is to use these pillow pillows, work in prone because she's dying for it, and perhaps just reduce the amount of time that you have her face down. Most clients are going to be coming in, having just nursed or just pumped. So they're going to be as empty as they're going to be right at the beginning of the session. So, if you're going to use prone, I would say get them into prone right away. Do your work, and then perhaps have them in supine for more than half the session, in prone for less than half the session. All right. Here's supine. Supine is great for abdominal work, for the mother swaddling, which is what I call the work that is a nod to the closing of the bones ceremony. And I'll show you what that looks like a little bit down the road. And supine is also great for doing the anterior neck work that new moms really need. We do want to use a large knee bolster to really support the low back when we're doing work with new moms. Semi-reclining. This is an alternative position, and most often I end up in semi-reclining if someone is either very newly post C-section, like within the first week, I would say. And we can do a lot of lymphatic work in the legs while they're in this position. The other thing is that sometimes we'll have them in side lying on the table. Their baby needs to nurse. Some moms are going to be able to nurse in side lying and stay in that position and not have to get up, and that's wonderful. Other moms are not going to be able to do that. That's either, because, well, let's just say breastfeeding can be hard. Breastfeeding can be challenging. So even if a mom, first time moms, there's a huge learning curve. Second time moms, sometimes you're relearning it again too. And so being in semi-reclining tends to be an easier, more universally accessible position for new moms. And so, we have to be super adaptable as massage therapists working in this, very sacred and special window in these families' lives. And so sometimes you are going to have your client get off the table, go to her bed, nurse her baby, and this is going to be a great time to work on her feet because that's something that she can fully relax into. And you can also help her, put pillows under both of her elbows, make sure she's really comfortable so she can relax, but you don't have to necessarily stop the whole session either, and be respectful of your own time. Okay, so what do we want to know about this client going into a postpartum massage? How can we put together a really thoughtful session without knowing some key details? So here, I think, are the details that are the most important. What was her birth experience like? And that's not just what happened, but it's the overall experience and how she feels about it. So definitely we want to know whether she had any complications, whether she had a C-section, an epidural, a hemorrhage, forceps, any of those things we want to know. But we also want to know just her overall experience of that. So we want to actively listen to the mother's needs and preferences, including any areas of pain or tension, her preferred pressure levels, and any specific requests that she might have for the session. Putting it all together. So I do my intake process online when someone signs up, and it's pretty in-depth. I'm going to go through what questions I ask, but here are some things that you can consider asking. You want to know if there were any complications with her birth. You want to know about her medical history, if there are any pre-existing conditions that you should be aware of. You want to know if there are any recent injuries, including injection sites. You definitely want to know how postpartum is she. Are we talking days, or are we talking weeks, or are we talking months? You want to know what her expressed needs and goals are. And then you can weave those into the universal needs of new mothers. And you want to know if she has an IUD in place. And I mention this because that, even though that might sound surprising, if you are doing a postpartum massage, someone might have gone in for their 6-week postpartum visit and had an IUD put in. And so you might, be dealing with a very, newly postpartum mom who also has an IUD in place. And that will influence the depth that is appropriate for your abdominal work. So that's something that you want to ask. And you also want to not assume that she wants abdominal massage. Now, I hope that she does, because there are so many wonderful benefits to it, but we also want to explicitly ask permission for that and be invited into this area, because it is extremely vulnerable. It's extremely vulnerable with any mammal, right? But it's extremely vulnerable, even more so when you've just given birth, and you have this kind of doughy center, and you're squishy and organs are out of place, and and so you might be sensitive about stretch marks. There's all of these things. Just want to say that it can take, even though there are huge benefits to it, you still want to be invited, and a client may not even feel safe enough with you if you're just meeting this client the first time, and abdominal massage may need to come down the road once you've built up some trust with them. Okay, so I'm going to go through some of these questions. The 2 columns on the left are questions that I ask in my postpartum intake form, which is filled out one time. And then the questions on the right are what I put into my postpartum questionnaire, and these are filled out before each session. So in the postpartum intake, we're talking birth details, what happened, delivery date, when it happened, who was on their team. I let them know what other services we have for them to get a gauge on what they might be interested in, if they had any complications, if they had any pre-existing medical conditions. We're looking at if they have had any past injuries or surgeries that we should know about, if they have an IUD in place, and I have them acknowledge that if they are post C-section, that it's not going to be appropriate to work directly on their scar until they're at least 8 weeks postpartum. Moving over to the postpartum questionnaire. How postpartum are you going to be at the time of your appointment? So you know that right up front. What are your specific goals or focus areas that you would like? Are there any recent health updates that we should be aware of? And then I let them know about some of the benefits of abdominal massage. And I ask them, would you like abdominal massage included? If you're more than 8 weeks post C-section, would you like scar work included? And then there's an option for I would not like my abdomen touched at all. And then I also ask about how to best support their breasts. And I word it in this way to help us provide the best breast support during your session. Are you breastfeeding? And the options are yes, exclusively. So that will tell me that I really want to be mindful of not having much pressure, if any, on breast tissue. Then they can answer yes, they are, or they can answer no, they're not. And we just want to be mindful of how we ask these questions, because breastfeeding is such a loaded topic in our society. And it's so easy to even inadvertently tip someone into feeling guilty or inadequate or whatever. And so I just want to be mindful of, like, we're only asking this question to know how to best physically support your breasts for the massage session. And there's no other anything attached to that. There's no judgment attached to that. So just being thoughtful about how we ask those questions. And then I also ask about their communication preferences, because, and the options are, just so you know, in case you want to do this in your own practice, the options are go with the flow. And that means that we follow their lead. We are only speaking if the client speaks first. So we want to be super mindful not to chit chat with our clients. We are holding space. If they want to tell their birth story, that's wonderful. Other people will just deeply be in need of rest. And I cannot tell you how exhausting it can be for a new mom just to feel like they are supposed to be polite and carry on a conversation. So please, please, please be mindful of this, and only talk if the client talks. Follow their lead. The other options in here are educate me, which means they want to talk about things that help them either understand their body better, what you're feeling in their tissues. They might want to pick your brain about their healing process. They might want to know about things that you have heard have worked well for your other clients. And that's how I frame it. I don't generally make suggestions other than, like, I have seen this work well for these people. It might be something to try or to look into or to research. That way you're really giving still the responsibility for any ultimate decision to your client. And then the other option is a silent massage. And, some people are so grateful to even know that that's an option right up front that they can select, because lots of people don't know how to ask for that, or they feel like it's rude to ask for that, but that might be deeply what they need. And that doesn't mean that you can't just occasionally check in about, like, safety or comfort. Of course you can do that, but it just means, other than that, you're being really mindful to be quiet and give them a real space to go inwards and to rest. That can be hugely beneficial to a new mom. So something to consider is just asking about their communication preferences. I also ask that they sign off that they will take responsibility for expressing their needs. If anything is uncomfortable, that they let me know right away so that we have a chance to fix it. And then our cancellation policy and all of that is in there as well. Okay. So again, while it's ideal to keep 100% of the focus on the mom, sometimes we may end up with baby on the table with us. Or, like I mentioned earlier, sometimes someone might need to get off the table and go nurse in bed. Flexibility is the name of the game with newborns. And just to let you know, have kind of general expectations, it's going to be rare for you to get through an entire 90-minute session for a mom with a newborn. 90 minutes is a long time for a newborn to not need their mom. So if you have a 90-minute session booked, it may end up looking like this photo, just so you know. And 60 minutes is a little bit more realistic. Oftentimes it can still look like this at the end, but it's a little bit more often that you can get through an entire 60-minute session with a newborn. And this is actually me with my firstborn getting a massage at 3 weeks postpartum. These are Angelica's hands on my shoulders. She came to my house, and I was able to nurse inside lying. So I was able to stay on the table and just bring baby on with me. My mom had come and was watching him up until that point, and then he just maxed out and he needed to be with me. So this is just an example of what it can look like and how we can work to make this work for new families. If you are having postpartum clients come to your office, I because I have multiple rooms and other people there, I don't invite new babies into the office. I encourage them to get a house call. So I can definitely get through, an entire session with a new mom if they're coming to the office, but it's something to consider. What is your setup like? Do you have other clients that might be on tables that are going to be disturbed by a crying baby? Or if you have your own office and you want, hopefully somebody will still be with the baby while mom is getting a session, but if the baby were to cry, you could even do this in your office. So you have to see what makes sense for your setup and your life. Okay. Keep the feet in your back pocket. And what I mean by that is that I save the feet for curveballs. So like I said, if the mom has to get up and go nurse the baby in bed, if she starts like getting into really emotional content, I have the feet in my back pocket, and that's where I go during those times. So I would say don't waste the feet, as I like to say, in the early part of the massage. Keep it for when you feel like it's most useful, because it's a really great tool for grounding or for being adaptive to baby's needs. Okay, so here is what the swaddling, I call it the mother swaddling, you can call it the sealing, the closing, the wrapping of the mom. And what we're doing is we are putting a flat sheet down. Her body is on top of a flat sheet, and then and just so you know, I do that at the very beginning of the session. If you're setting up and side lying, you're going to be using 2 flat sheets anyways. And then if you were in side lying, you would help the client sit up. You take all of the side lying pillows out. You help her move into supine, and then she's already laying on top of a flat sheet. And then you can take both sides of the flat sheet and bring it up around her body. I like to use an oversized flat sheet for this because there's more material to work with. I also like to use oversized flat sheets because in prenatal work, anyone in 3rd trimester is going to need generally a little bit more material to feel fully covered. And that's just a nice way to meet those needs. So you are taking the flat sheet, you're bringing it to the center of the mom's body, and you're rolling it. And you're rolling it at her midline, and you're creating like a mother swaddle. You're creating almost like a hug for her whole body. And then you can hold the material in your hands, and you can move with your whole body back and forth and rock her. And not only is that rocking motion soothing to her nervous system, but it will also start to allow any material that's stuck underneath her to come up and around. So as you rock her, you'll get more material, and then you can like tighten it up, and then you're going to move all the way down her body to her feet and swaddle her down to her feet. And this is what I do at the end of the session, and then I can work on her feet as well to close out a session. Okay, so designing a truly gratifying postpartum massage is going to require a comprehensive understanding of the new mother's physical and emotional needs, cultural insights, safety considerations, and optimal positioning options for her. And then you can create a nurturing and effective massage that supports her recovery and well-being during a very transformative period. Mothers will never forget how they're treated, how they are spoken to, and how they are touched during this time in their life. And I feel like as massage therapists, we are, uniquely poised to really show up in a deeply meaningful way during this time. So we want to think about assessing our equipment. Do you have an Oakwork sideline positioning system? You don't have to, but if you have it, it gives you a lot of options. Do you have a plethora of dense pillows? If not, that can work just as well. Do you have breast supports? And those little pillow pillows that I showed you are great, but you can also use just a rolled up towel. You can use a small pillow, anything to take some pressure off of breasts if you're going to be having a client in prone. Do you have oversized sheets for wrapping? So those are things to consider. Determining the best position. Are you, most of the time I'm beginning in side lying, or you can use prone, and then you're going to be ending in supine because that's the position that's best for abdominal work and for the wrapping at the close of the session. And you can do the wrapping, I would say, do it for the first time that they come in postpartum. So that's, you might be seeing them 1 week postpartum, or they might not be able to get in until they're 6 months postpartum. So if it's their first postpartum session, I would do the wrapping. And then you can do it several times if they really like it. It's quite soothing and wonderful. So what are we doing when we're thinking about choosing techniques and the order of techniques? First, we're going to figure out like what generally is the first position that we're going to have our clients in. So here's an example. If side lying was one of the first positions that we would have them in, then we're going to split the techniques into oil-free techniques are going to come first because you can't take oil off once you've put it on, and then the oil techniques are going to come second. Within the oil-free techniques, we're going to split them into 3 categories. We're going to split them into autonomic sedation techniques. Then we're going to split them into mobilizing techniques, and then move into deep tissue sculpting techniques. And here are a few examples of techniques that fit into each of these categories. Again, all of these come from Pre and Perinatal Massage Therapy, the 3rd edition. So for the autonomic sedation techniques, there's a technique that's wonderful that's called the 311. You can do spinal rocking, occiput traction, the cervical transverse rocking. Those are all soothing and sedative to the nervous system. Then you can think about some mobilizing techniques at the pectoral girdle. You can do the stretching and circling. There's some decompression techniques for the pelvic girdle that are also mobilizing techniques. Those work great there. And then for deep tissue sculpting, you can do things like sacroiliac joint, rhythmic deep tissue sculpting. You can deep tissue sculpt the lateral pelvis all the way around to the deep rotators. You can do trapezius, levator scapula, scalenes. Wrist flexors are a great place to deep tissue sculpt on a new mom. Usually all of these are shortened and tight. And same thing with pec major and pec minor. The only thing with that work in the chest is to be mindful of where breast tissue starts. It wasn't as bad with my second baby, but I remember with my first baby, my breast tissue started, like, I'm not joking, literally at right underneath my collarbone. It started like way up here. It was just wild. And it didn't, last forever, of course, but you just want to be mindful that when you are looking for those attachments for pec major, for example, that you're checking in with your client, that you're feeling in your fingertips, does this feel like I'm on muscle tissue, or does this feel like I'm in breast tissue that can be, in places that you wouldn't normally think it would be in early postpartum. Same thing with doing any work in the axilla. You're going to find breast tissue is more pervasive than you would otherwise think. So just checking in with your clients. It doesn't mean don't work there. It just means work mindfully and be in good communication with your client. Okay, so those are all the oil-free techniques. And then you can move into techniques that use oil. And I usually split those into 2 categories. One is going to be the anatomically specific work, and then the anatomically unspecific work. The specific work can be things like getting into the laminar groove on either side of the spine. You can do lumbar connective tissue massage, intercostal work on the sacral attachments to ease tailbone pain. And then the anatomically unspecific work is just like the amazing Swedish work of arms and legs. And that work is also so great for promoting relaxation and just general comfort. So that's how I start to kind of tie it together. And then we can look at what that looks like in more detail here. let me see. Here's an example of second position. So here's what supine can look like. So again, I've got these split up into oil-free techniques and oil techniques. The active mobilizations could be things like breathing enhancements, pubic symphysis rebalancing, or neck stretches. Then you can go into deep tissue sculpting, which can be in the upper body and the forearms. And then you would do C-section work if applicable at this portion of your time. You want to be in supine and you want to do C-section work before you put oil on the abdomen. And once you complete those things, you can move into the oil techniques, and you can do anatomically specific ones, including anterior neck. And we're thinking SCM is a big one, sternocleidoid mastoid. And then we're thinking about moving into abdominal work, which includes quite a few options. You can do kneading, vibration, deportment, trigger point, fundal massage, uterine positioning, iliopsoas rebalancing. And I guess this is a good time to zone in a little bit on fundal massage. So fundal massage is a technique that we can use to really target the uterus itself. The fundus is the top of the uterus, and we want to massage it to encourage it to keep involuting, right? To keep getting back to that pre-pregnancy size. And that's also what is going to start to overall diminish the bleeding that a mom is experiencing. However, it's really important to note that if your client, well, I was going to say gave birth in a hospital, but oftentimes even home births, this can be a factor, is that many practitioners do something that is called fundal massage, which is so rough and honestly borderline violent that if you use the words fundal massage, you may see your client's eyes go like, that's what they called this horrible thing. And that's oftentimes like practitioners are jamming their hands deep into the abdomen and very vigorously, just churning around on top of the uterus to get it to involute. And it's supposed to help stop bleeding, but oftentimes it is, it's rough. I mean, I have had many clients up to now say that it was the most painful part of their entire birth experience. And I think we really have to look at a practice that's being described that way, and why it's being used in that way. So I just wanted to contextualize that, because if you happen to use the words fundal massage, what we do is truly a massage. What they may have experienced is definitely a euphemism for massage. So I think it's important to know that and to contextualize that, and to perhaps even warn your client, I would like to do some fundal massage, which if you happen to experience that, during your birth, is not the same thing. Okay. It's not the same thing at all. So that they know that they don't have to brace themselves to be hurt, essentially. Okay, so those were the specific oil techniques, and then you can do anatomically unspecific techniques in supine. You can do the Swedish of arms and the legs, and you can also just do general like peristalsis, sun and moon kind of strokes on the abdomen as well, that are really soothing and lovely in supine. Okay, other factors to consider when creating a thoughtful massage session. You want to help talk her through, or perhaps even physically assist her with position changes. So remember, her core is not going to be completely online. She might be healing from surgery, all of these things. So we want to be really mindful of how we're having her change position. So for example, if you are in side lying and you want to have her turn over to her other side, you can think about having her either, push up on her hands to come to sitting, and then gently turn over to the other side, and then help her back down, perhaps. If you're having her, especially I would say going from either side lying to supine or prone to supine, having her push up to sitting, kind of holding the sheet around her. If you have side-lying pillows, you're going to take those pillows out and then help her. I would usually put my hand behind my client's back, on her spine, and just slowly help her ease down, or have her come onto her side first and then slowly roll onto her back so that she's not over engaging her core or straining anything. Again, you want to keep the spotlight on her. And then I think another hugely important thing for us as therapists, if we really want to be of the highest and best service, is to make sure that we are acknowledging and addressing our own, internal biases before stepping into our clients' sacred spaces. And it's normal to have biases. We all have biases. I can own for sure that, especially after, being in birth work since 2011, I have gotten to a place personally where I would, rather not deal with the institutionalized medical system at all. I think that they are failing a lot of us in too many ways. And so that's my personal stance. Can I still show up for the vast majority of my clients who are birthing in hospitals without bringing my own stuff into their space? Of course I can. But it takes being able to be aware of your own biases and your own thoughts, and making sure that you literally leave them outside of their space so that you can show up clean in somebody else's space. I've had some mentors who have said, even visually, if you're going to do a house call, for example, even visually, imagine that you have a suitcase of your own stuff and putting it down outside of that person's front door before you walk into their space. And that can be a suitcase full of your biases, but it can also be just a suitcase full of your own life stuff, like the fight that you had with your partner, or your kids' upcoming, shows, or things like that. Just anything that's going on in your own life that you can just kind of put a pause on, set it aside, and just be present with your client. That's going to put you in a place to be more fully of service. Okay. And then again, just following her lead with communication style and really trying only to speak if she's speaking. Okay, so here's kind of the general guide on how we want to think about putting all of this together. So you're going to gather your intake information, you're going to assess what equipment you have and determine positioning. Usually you're going to do probably 2 different positions in the course of a massage. That may not always be true. There might be times where, especially post C-section, for example, you might be in semi-reclining the whole time, and that's fine. But just thinking about which positions make the most sense. And then you can make sure that you save your footwork. Like I say, put it in your back pocket for any curveballs with the baby. Then you can start planning out your oil-free techniques, separating those into sedation techniques, mobilizations, deep tissue sculpting, and then moving into your oil techniques and into the anatomically specific stuff first, anatomically unspecific stuff after, and closing with a mother swaddling with the flat sheet and or grounding footwork. All right, so now we're going to segue into looking at 4 different case studies, and we can start to think about what would be the most appropriate ways to put together a session for these specific mothers in these specific circumstances. All right, so here is a case study number 1. So this mom had an uncomplicated home birth. She's 1 week postpartum. Her main concern is her new mother's neck, and she is exclusively breastfeeding. So if you just want to take a moment here and think about, what would you think would be the most pertinent for her? What positions would be the most pertinent? What comfort measures are you concerned about? What safety considerations are you taking in? How would you address her main concern of her neck being stiff? All right. So here's an example of what I put together. And this is just one of many ways that this can look. But I chose side lying and as the first position, and you would repeat it on both sides, and then closing in supine. So let's go through the left side of the screen. Position number 1, side lying. Some oil-free techniques. First, we could talk about some autonomic sedation techniques, and that could look like spinal rocking. And spinal rocking is wonderful because not only are you soothing the nervous system as you move up and down the spine, but it's also a wonderful assessment tool for you to see how much are things moving, where are we stiff, where do I need to come spend some more time during the course of this massage. So it's a great opening. You can do some occiput traction because her neck is bothering her. You can do some cervical transverse rocking as well. You can think about moving into some mobilizations like pectoral girdle mobilizations, some stretching and some circling, moving into some deep tissue sculpting at the trapezius, at levator scapula, getting into her scalenes can be huge. And then again, the pec major and minor attachments, being mindful of breast tissue. And for the oil techniques, we can do some laminar groove inching, and that particular technique targets the very tiny and often strained muscles of the multifidae and the rotatories, and it feels so good. It can be a wonderful way to help relieve her back and her neck, and then just doing some Swedish of the back and the hips, helping her change to the other side, and then repeating that again on the other side. Once side 2 is done, you can help her push up on the table to sitting, and then remove either the pillows or the side lying system that you're using. Help her come down into supine, and then think about some oil-free techniques. I would start with perhaps some neck stretches to help get some length and some mobility back in there. And then you can think about some anatomically specific work as well with the oil. And that would be, sternocleidomastoid in the front would be great. And just general neck work in general is yummy. Then you can move into some abdominal work, including things like kneading, vibration, tapotement, uterine positioning, and moving into some anatomically unspecific techniques and doing some Swedish of the arms and the legs, and then moving into the mother swaddling, taking the top sheet at her shoulders and starting to wrap all the way down to her feet, rocking her all the way down as you go. And then you can unwrap her, do some foot reflexive zones, and close the session. So for this example, we were imagining that this potentially was a 60-minute session, and you would do about 20 minutes on each side in side lying, and then about 20 minutes in supine as well. So, and again, these are not hard and fast rules. This is just to illustrate what this could look like. And of course, there's lots of room for individualization for what makes the most sense for you in your practice. Okay. So here's case study number 2. We have a mom who had a vaginal hospital birth, and her baby is in the NICU. The baby is still in the NICU. The mom is 2 weeks postpartum. She's dealing with a lot of worry, a lot of disappointment, and she's very unrested, and she is pumping. So what do you think her overall needs are going to be? What can we help facilitate as massage therapists? What are the things that this mom would need individually, and what are some of the things that she's going to have as a universal need as a new mom? Okay, so let's look at this here. She's definitely going to be, like we said, unrested, right? She's not able to stay at home. She's back and forth to the hospital visiting her baby, right? So things that we can do to promote rest and relaxation are going to be huge. This is what it can look like in a 90-minute session. And I just wanted to illustrate like this. I numbered each one. So in a 90-minute session, we got through about 20 techniques. And in the 60-minute session, we had about 17 techniques, 17, excuse me, 17. But you can see like there's a lot more going on in this outline because it's just a longer session. So again, because the mom is, she's pumping, she's only 2 weeks postpartum, I tend to want to keep pressure off of breasts. I'm going to choose side lying again. What else? She might want to share. Side lying is also great. I didn't mention this. I should have probably put it on the benefits slide, but it puts you in a fetal position essentially. You're curled on your side, and that is a position that highly promotes a feeling of safety and a feeling of relaxation. So that's another potential reason for this mom who's so deeply in need of rest and relief from worry, that having her in a position that feels really safe can be also highly therapeutic. Okay, so let's move through this one here. We've got position 1 could be side lying. And again, we're thinking about what oil-free techniques are we going to think about first. We can do 3-1-1 again. We can do spinal rocking, occiput traction, cervical transverse rocking, moving into some mobilizations, pectoral girdle mobilizations like stretching and circling. And I've put some figures here too if you wanted to look these up in pre and perinatal massage therapy textbook. You can do some SI joint decompressions, moving into some deep tissue sculpting, paravertebral deep tissue sculpting. Yeah, and I remember too why I was thinking of some more work in the pectoral girdle or some work. I'm thinking about things that I can do to help open up her lung capacity, because we know when we're stressed and we're worried, our breathing often gets fairly shallow. So opening up the pectoral girdle, moving down all of the paravertebrals in her back body can open up the capacity in her back lungs. Those are things that I was thinking about when I was putting this together. And again, this is just an example of what this could look like. There are many other techniques that you can pull from. I'm just giving examples of how I'm organizing techniques to put into a flow in a massage. So same thing with levator scapula, scalenes. Just if she's holding, if she's holding her breath, she's worried about her baby, she's not resting, she might need just to feel unburdened in that way. Thinking about some oil techniques, some lumbar connective tissue massage. This is something that's only taught in person. I just put that there because I didn't have a reference to do in the book. Same thing with sacral attachments. That's also not in the textbook. And then moving into the anatomically unspecific work and doing Swedish on her back and her hips. And then changing sides and repeating. And then again, helping her push up, taking out pillows or bolsters off the table, helping her come back down into supine, moving into some oil-free techniques. I would do some scalp massage because we're really thinking about this mom who's worried, whose thoughts might be just looping. If you have a background in craniosacral work, this is also a wonderful person to perhaps do a cranial hold on and just help relieve some of the circular thoughts and worry that are going on in her head. It's also highly soothing to the whole nervous system. So scalp massage you can spend a good amount of time there. I would also do the breathing enhancement for this mom as well, because again, I'm thinking that with all of the worry, she's probably lost some of her lung capacity, and just helping her get some more lateral space in her rib cage would be really helpful. And again, that's also why I'm thinking about doing rib cage trigger points, abdominal work if she's open to it, kneading, vibration deportment, uterine positioning. She's 2 weeks along now, so I would start to perhaps add in some iliopsoas rebalancing as well to help kind of get her core muscles and her brain to connect a little bit more to help support her. That's a good time to start bringing that in. And then the anatomically unspecific work, Swedish of the arms and legs, can be deeply relaxing and helping promote rest for her. along with the mother swaddling, and then the grounding hold is different than the actual footwork. The grounding hold is something that can also be used in labor massage, but it's where you take the first 3 toes on each foot and you are squeezing them together, and it's deeply grounding and helps someone feel very present in the present moment. So that could be potentially helpful for this mom. So in this 90-minute session, we've kind of broken things down roughly into 30 minutes on each side and then 30 minutes in supine. Yeah. Moving along to case study number 3. All right, so we've got case study number 3 is a C-section. And this was an unplanned C-section. It was a home birth transfer. This mom is going to be 2 days postpartum, and she's dealing with painful swelling. She was referred by her OB, and she's not producing breast milk yet. She's only producing colostrum. So thinking about what this mom has been through, thinking about what her hopes were versus the reality, versus where she is at physically and her limitations in terms of where she's at with her healing. She's like not healed at all. What position is going to be the most supportive for her? What is the main focus? What are her main needs right now? How can we show up as massage therapists to best meet her needs at this time? Yeah, just think about that for a minute here before I turn the slide. Okay, so let's see what I put here. All right, so this one, I'm thinking that we're probably going to be in semi-reclining the whole time. And we may be working in her bed the whole time. So, and again, you can decide how flexible you can be, because, people's beds are different sizes. Each of us has to be protective of our own body and our own body mechanics. So see what makes sense for you. But if you are comfortable working on her bed, it might be nice, especially since she's so early on, post-op. C-section is a major abdominal surgery. Working with her in her bed and keeping her semi-reclined could be the most supportive. Or if you're going to have her get onto the massage table, that you're being really mindful to help her and make sure that she's not straining anything, that she's not going to be pulling any stitches to get onto your massage table, whether that means using a stool, physically helping her, having, if she has, a partner or a family member helping her get onto the table. Just be very mindful of how you are helping her get positioned in the first place, or working with her in her own bed. So, and then there's not going to be a whole lot of variation that's going to happen in this massage. Like, your number one priority is going to be clearing fluid from her lower body. And we know that lymphatic work is meticulous and it takes time. And so our expectations of what we're going to be able to do in this session, there's probably not going to be a whole lot more than just lymphatic work that you're going to be offering this mom at this time. And there's nothing wrong with that. I wanted to share too, I had a totally unnecessary and pretty traumatic C-section for my first birth. And then luckily, I went on to have a sovereign birth at home with my second. But I can tell you that the recovery post C-section, the amount of swelling that I had and the amount of pain that it caused was pretty amazing. So my toenails, like, I had so much swelling in my feet and in my toes that my toenails were just like buried. Like the edges of my toenails were buried, and just the feeling of the sheets. I remember the feeling of the sheets moving across my feet made me wince. And so when we're thinking about that, that's not a totally unique experience to me. I was very lucky, obviously. Like, I had, some wonderful women on my team came to my house and saw me, and I got to have some lymphatic work done, very early postpartum. And it was It was unbelievable the amount of relief that they gave me just from doing some flushing of my lower body and getting some of that fluid out of my legs. And so I just wanted to tell this story so that you don't walk into a situation like that and feel like mentally you're like, all I'm doing is a little bit of lymphatic work. Like, what you're doing is huge. What you're doing can provide so much relief at such an important time. So please don't think that what you're doing isn't enough. It's huge, huge, huge. It can provide such tremendous relief. Yeah, at a very vulnerable time and needed time. So we do want to be mindful and cautious. There will be injection sites, there will be IV sites, there will be epidural sites for this scenario. So making sure that you kind of check in, know where those are. And then we definitely want to be mindful of blood clots. Blood clots are going to be a factor in any postpartum situation, but they're going to be even higher post C-section. So again, when we are doing work on the legs, we're using, whole hand, feather light, broad pressure to flush the legs, or fingertip pressure. It's very, very light work. And we're not doing any kind of shaking, wringing, or jostling of the legs. And we're also not doing any shaking, wringing, or jostling of anywhere else in the body, including, for example, like an arm. Like if you were to like try and shake somebody's arm, but it's traveling through their body and traveling into their legs, we don't want to be doing that either. So just being mindful of what you're doing. And honestly, like shaking and wringing and jostling for somebody who just had an abdominal surgery is not going to be a great idea either. They're probably going to say, ouch, that doesn't feel good. So just being mindful. This is going to be likely a very meticulous, just flushing the lower body session. And that's what's going to take up the majority of the time, whether that's 60 minutes or whether that's 90 minutes. If you have some extra time, for example, like if you had 90 minutes with this client and, she's been, for example, nursing her baby the whole time because she's in semi-reclining and you're just doing work in the lower body. So baby's, content and fine. Once you've finished with the clearing of the lower body, you can move into things like scalp or face massage. You can move into things like wrist passive movements or deep tissue sculpting her wrist and her flexors, in the areas where she doesn't have any injection sites. And then you can also do Swedish in her arms and shoulders and all of this without having to move her out of semi-reclining. So yeah, I hope that illustrates how adaptive and flexible things can be in situations like this where it's very early postpartum. And I also hope that you can see just what a wonderful and supportive role you can play in the healing journey of a new mom post C-section. All right, this is our last case study here. So this is from a planned C-section. So, and this mom is going to be 12 weeks postpartum. She just generally has fatigue. She's exhausted. She's got some pelvic pain. She's very interested in getting some C-section scar work done, and she is actively breastfeeding. And let's just say this mom also is just like, I just want to lay face down. So take a minute, think about how you would set that up. How much time would you spend face down? What kind of supports would you use? What are her other main pain points? What kind of techniques would you think about implementing here? Take a minute and just think that through. How would you start to tie this all together? All right, so let's see what we've got here. Okay, so because she specifically asked to lay prone, we can make that happen. And you can see, like in a 90-minute session, if I'm jumping down to the bottom right corner of the screen, did I split it exactly 50-50 down the middle, of prone versus supine? I'm like, no, I put her a little bit less time face down because I'm thinking about the fact that she is actively nursing. So still giving her what she wanted, but reducing how much time we've got some pressure on the breast. Because even with the supports, there's still some level of compression that's going to happen to that breast tissue. So I'm just trying to be mindful of how much and for how long are we doing that. All right. So let's go back up to top left. We're looking at position 1. She's lying prone. Maybe we're using those pillow pillows. Maybe we're using some rolled towels, something to give her some support under her breasts. We're thinking about, the oil-free techniques that we can pull from, full body rocking. If we're moving into some mobilizations, we can do some pelvic girdle mobilizations from here. We can do some breathing enhancement here, which is great. And then there's a lot of deep tissue sculpting that can be adapted to prone. You can do paravertebral sculpting. You can do the sacroiliac joint rhythmic deep tissue sculpting, lateral pelvis deep tissue sculpting, because I'm thinking about, she's having some pelvic pain. You can do deep tissue sculpting in her forearms as well. And anatomically specific oil techniques. Moving into oil techniques, we can do something in the laminar groove, and then just some, Swedish of the entire back, her glutes, her hips, and her legs. And then having her turn to supine. And one thing that I didn't mention that I think is worth mentioning is that there are going to be times where it's going to be appropriate for your client to take a bathroom break between position 1 and position 2, especially if you're doing abdominal techniques, especially if you're doing techniques that really target the uterus, because to get to the uterus, you're going to go through the bladder, right? And so, or you're going, they're all in the same fascial matrix. So you're going to be influencing the bladder. And if it's full, it might be appropriate to have your client get up, use the restroom, come back, get into supine, and then continue with some of these abdominal techniques to make sure that she's the most comfortable to receive the abdominal work. Okay, so thinking about top right again, position 2, supine. You can definitely do some scalp massage, which is great. We can do some pubic symphysis rebalancing. That came to mind because she just had some general pelvic pain, and sometimes we don't know if that has to do with pubic symphysis. If she had some of that pain in pregnancy, that doesn't always go away in postpartum immediately. So checking out what's going on with her pubic symphysis, seeing if it can be reset a little bit, can be really helpful. And then moving into C-section scar massage. And the first time that you're working on a C-section scar, it can take anywhere from, I would say, 5 to 15 minutes tops. That's usually about what a person can physically tolerate versus what the scar itself can tolerate. And I wanted to really kind of dig into the difference between the two, because I'm looking at both as a practitioner. I'm definitely listening to my client, and if they're saying, I let them know there can be a variation in how much you're going to be able to tolerate your first time. And then as we create some more freedom in the fascial structures, in your scar, and, we're remodeling your scar, it's going to get used to the touch. It's going to have more flexibility. You're going to be able to tolerate more. The work itself, I also let clients know, it can feel intense, but it shouldn't be outright painful. So, and the intensity often will feel, it will feel hot, and it can feel like very small ripping or tearing, which sounds kind of awful, but it also feels so good in the sense that it's very freeing. And having been on the receiving end of it and feeling that sensation in my own body, it is really unique. But you can feel that it's therapeutic. You can feel that it's freeing up something that is stuck and that is inhibiting you. So some clients are going to be like, I love it, I want more. And other clients are going to be like, okay, I know this is good for me and I can tolerate this for about 2 more minutes and then that's it. And both those are very valid. They're very valid. So just really following your client's lead and tuning into their verbal cues, but then also listening for the visual and tactile cues from the scar itself on what it can handle. So, for example, sometimes I have clients who are just like, I just want to, this scar is raised, this scar is ugly. I want the most that I can get, done in one session, but the scar itself is telling me that it is done. And what I mean by that is, as you're working on scar tissue, you're going to be bringing in a tremendous amount of blood flow. Warmth in the area is normal, but at a certain point, you're going to see that the tissue is going to get hot to the touch. It's going to get red because there's going to be a lot more blood flow. And at a certain point, it's going to start to, you can cross the line from going from this being therapeutic and being something that the body can integrate and take in into creating a lot of inflammation in the tissue. And we don't want to cross that line. So there's a little bit of communication that has to happen with your client of like, if there's a mismatch between what your client is saying and what the tissue itself is telling you, it's really important to communicate with the client what you're seeing and what you're feeling. So it doesn't usually happen that it's a mismatch, but it can occasionally, because most of the time, if you're seeing these signs that the scar itself is kind of done for one session, usually the client is going to match that and say like, yeah, I'm feeling like I'm done. This is as much as I can handle in one sitting. And that is what scar work is. Like, it's also very important to let your client know that this is usually going to be a series of, working on this. And usually I'll tell my clients like anywhere from like 3 to 10 sessions can really give you a lot of, you will feel a lot of benefits from that and difference in the landscape of the scar itself. So, but if you were to have a client that is telling you, no, I just want to do more, you want to sit there and describe like what you're feeling. You say, I really hear you. And I know that you want to, you want this to feel better. You want this to feel free. You want it to look better. However, your tissue is telling me that it has had enough for one sitting, and here's what I'm feeling, and here's what I'm seeing. It's really red. It's starting to get inflamed, and we don't want to cross into that. That no longer becomes therapeutic. That becomes like a hurdle for your body to have to overcome. And then just saying, and we can do more next time. Like, this is just the beginning. Your body's going to integrate what we did. We did a lot of great work today. And we're going to find, the next time that we come and work on this together. Or you can also teach your client what you're doing so that she has the power in her own hands to work on it at home. You can let her know, let this settle for a day or two, and then you can start to, work this tissue on your own. You can come back and see me. We can do more layers of work, and then take it from there. So, long story short, especially like in the first, few sessions of a C-section scar work, 5 to 15 minutes is really going to usually be enough time to see significant changes in a scar. All right, so those are the oil-free techniques, and then you can move into some oil techniques, including abdominal work. And I definitely would include the iliopsoas rebalancing for a mom that's 12 weeks postpartum. She's her C-section is healed enough to be doing deep work. The only thing that I would take into account is whether or not she has an IUD in place. So just being mindful, I don't do much more than surface level work with anyone that has an IUD in place. So I would not do iliopsoas rebalancing likely if she has an IUD in place, just because even if you're not anatomically like right over the uterus, sometimes I would just be mindful of like just the fascial connections in there, of moving things around too much. Okay. Definitely some trigger point and rectus abdominis work. This can also be quite helpful because she's saying that she has, some pelvic pain in general, and trigger points can relay pain, all over the place, including, some of the places that you might find this is near the attachment at the pubic bone in the lower fibers of the rectus abdominis might have some trigger points that are affecting her entire pelvis. And just working on her C-section scar can absolutely help with her pelvic pain as well. It's going to free up a lot of binding that might be, solidifying in there. One more thought on C-section scars. We wait 8 to 10 weeks to even start the C-section scar work. And then if we can start work before someone hits 20 weeks postpartum, that's going to be the most ideal window to at least get started with C-section scar work, because the scar tissue itself has a lot less time to solidify. After we hit that 5-month or 20-week mark, it's going to start to get a little bit more bound up. That's not to say that we can't do great work anytime postpartum. I have worked on scars that are 20-something years old and created wonderful benefits, and the tissue is always going to be responsive to our work. It's just in that 10 to 20 weeks window, it's just highly responsive because it just hasn't had as much time to solidify in the way that it does post 20 weeks. So just keeping that in mind, if that happens to logistically work out for your client to come in during that window, it can be ideal. Okay, so we've talked about, the abdominal work. We talked about doing iliopsoas work. We talked about doing trigger point work in the rectus abdominis and potentially focusing on the attachments at the pubic bone that might be relaying into some of her pelvic pain. And then doing some Swedish of the arms, for example, would be great there. I would still do mother swaddling if this is her first time getting a postpartum massage, or if it's just something that she said that she has enjoyed. It's really, really lovely. And then I could also do some foot reflexive zones last here. So that's a 90-minute session. And again, a little bit shorter time with her in prone and a little bit longer time with her in supine. So yeah, and you can find some other things if you want to add more to what you do in supine. You can definitely do a lot of neck work, shoulder work in supine as well. Okay. So let's do a little recap of everything that we have gone over. So we've talked about the cultural gaps and the overall inadequate postpartum support that we have in the US. We have talked about the universal needs, including rest, nourishing food, loving touch, the company of wise women, and connection with nature, and how massage therapists are really uniquely poised to at least offer loving touch, if not possibly wise woman company. And, we reviewed some of the safety parameters and things to be mindful of in terms of blood clots, in terms of being mindful of injection sites, in terms of, making sure you have clearance if there's no signs of infection postpartum, and then talking about C-section scar timelines and when we can work on those scars. We can customize our massage techniques based on, the mother's birth experience and her expressed needs, figuring out what equipment would be the most appropriate, and then considering oil-free and oil techniques, splitting those up into subcategories of the oil-free techniques, sedation techniques, mobilization, and deep tissue sculpting, and then the anatomically specific and unspecific oil techniques. The other additional support that we can offer is making sure that we give clear instructions on everything, on what to expect, on how to change positions and or helping, making sure that we are addressing our own biases and that we are making sure that we are following the client's communication style. Okay. And I just wanted to mention that if you want to have some hands-on time, this webinar is wonderful. We can cover a lot of things, but if you want to really get into what this work can look like and feel it in your own body, I would just love to invite you to attend one of the 32-hour pre and perinatal massage therapy workshops that either I teach or any of Carole's authorized instructors. This is Carole and I in a course in San Diego I believe this was in 2018. Any of the course instructors are wonderful. This material has been around for a long time and is evidence-based and constantly refined. And it's just such a wonderful opportunity to get your hands on experience. We, as instructors and as TAs, like we actually work on you so that you have an idea of what this actually feels like kinesthetically in your own body. We work you completely on body mechanics so that this work becomes sustainable for you, so that you are able to offer depth and groundedness in your touch, which translates, especially in this population of new or soon to be moms. The course covers both postpartum but also prenatal and labor techniques. It has over 80 techniques in the entire 4 days that we would be together. And again, some of those techniques that we teach in class are not taught in the book. They're not taught anywhere else. So I hope that you would consider joining us for one of those classes. The next one that's coming up is in San Diego in November from the 4th through the 7th. But you can go to either my website or Body Therapy Education, which is Carole's website, and just see all of the options for upcoming courses. All of the instructors are incredible. I would love to meet you at some point in the future. And I hope that this webinar has been helpful for you and that everything that you learned can really help foster you being of the deepest and highest service to new families who I hope you feel after this workshop are deeply deserving of your care, and that the care that you give for them has long-standing and rippling effects, not just, from mother to baby, from mother baby as a unit to the entire family, but that also ripples out to create a more loving and more wonderful society for all of us to live in. So thank you for being here with me.